Now let's talk about the two biggest mistakes I see when it comes to magnet documentation, and more importantly, how you can avoid those. The first thing that I often see is that organizations spend so much time tracking all of their process measures that sometimes they forget to measure the results, or they forget to tie all of those processes to results. So maybe your team is really great at tracking hand hygiene compliance, but if you're not also measuring whether or not infection rates are improving, then you're really missing the bigger picture. My recommendation here is always connect the process to an outcome. So if you're looking at a process measure, always ask yourself, how can I prove this intervention actually made a difference? What is the result of all of this work? So again, always try to tie your process measures to a measurable improvement in patient care. The second biggest mistake that I see is reporting process measures as if they are outcome measures. So just totally getting them mixed up. So as if they're interchangeable, which hopefully after this video, it's pretty clear that these two are not interchangeable. And what I will say is that, especially for your magnet documentation, if you continue to get these things mixed up, it'll really hurt or hinder your journey, and then it'll definitely hurt your documentation. So how do you avoid mixing these up? Well, what I recommend is that when you're, getting ready to write up your magnet documentation, or as you're looking to see whether or not a story is going to fit, ask yourself a few things. Does this measure actually show what was achieved? Do we have a tangible result here? Or does this just track all the things that were done? So again, if it only tracks completion or compliance, this is a process measure. So my recommendation here is, again, to always link your process measures to a measurable patient outcome, to a measurable difference in patient care.